Which procedure is suggested to lift sagging cheeks, under eye bags, and nasolabial folds? Hello, I have been tormented by my saggy cheeks for my entire life. It feels as if I have gotten older. My nasolabial folds and under eye bags have become more pronounced. I also have some acne scarring on my cheeks and outer chin. Would a mini facelift do the trick to soften all of these issues? I am 28, by the way. Your responses are greatly appreciated. Thanks.
Thank you for your question. You state in your question and you submit a photo and you've blocked out your eyes, but in this question you're essentially describing a situation where you feel like your entire life you've had sagging cheeks, that you've had deepening as you've gotten older of the nasolabial folds and worsening of under eye bags, which you can't see with the blocking off. And you're asking about some way to lift the area of the cheeks and to improve the overall appearance. And you also mentioned some stuff about acne scarring as well. But I'm going to just first focus on the global issues. And again, you state that you're 28 years old. Well, I can certainly help you with understanding what is probably contributing to this perception. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I perform the full range of procedures, including minimally invasive to all the way to advanced surgical procedures. And so I can give you an understanding of really how I would interpret what you're describing. So to begin with, at 28, you're still very, very young. And so in terms of what you have dealt with throughout your life is really more about anatomy and not so much about age-related changes. Yes, you can have the perception that your cheeks are sagging, but I believe what is also an equally relevant way to look at this, and probably more appropriate for you, is that the cheek is just not well defined. You see, there's a difference between how we treat people with facial aging. With facial aging, it's about restoring. It's about volume loss and about sagging. When you speak about younger people, it's really often about subtle but natural enhancement to beautify, to create balance. So I would suggest that in someone like yourself, I would want to do the least amount possible to try to get the best outcome. So I would say that without looking at the under eye bags area, which is a topic that I'm going to discuss momentarily, in terms of the cheek and nasolabial fold aspect, I think it's worth considering a procedure that we refer to as structural volumizing. Structural volumizing is the application of traditional fillers such as Juvederm Ultra Plus, Juvederm Voluma, but placement that's different than traditional fillers. Traditional fillers are typically placed in cheeks and right under the skin, just whether it's the nasolabial fold or the cheeks. In structural volumizing, we're placing it between the bone and the muscle. And what's the point of that? Well, there's something called the golden ratio, and the golden ratio in facial harmony and facial balance is a ratio of a width of 1.6 to 1, where the top of the upper part of the face is slightly wider than the lower part. Interestingly, it actually can make a person look thinner, and that's because of the golden ratio. This is something that has been around for a long time, since ancient times. So when we do structural volumizing in the cheekbone area, accentuating the cheekbones can actually really enhance the overall appearance of the face. What I like about considering a hyaluronic acid filler, such as the fillers I mentioned, is that in the worst case scenario, you can actually dissolve these fillers and you can start from scratch. So the reversibility of this type of approach makes it very appealing. Now, if you have been having under eye bags for most of your life, then there's a very good chance you're dealing with something called lower eyelid fat prolapse. And lower eyelid fat prolapse means the fat pockets that are normally around the eyes push forward and create a bulge. Now, I'm not going to get ahead of ourselves and say that you're a good candidate for one procedure or another, but the options for under eye bags is based, in my practice, based on the relative prominence of the under eye bags. If they are relatively subtle and can be blended, then we use an injectable filler like Restylane to fill the area of the tear trough and create a better transition between the under eye bag and the adjacent area. We also use something like platelet-rich plasma derived from your own blood, but that's a different story if you don't have that much wrinkling or discolorations under the eyes. If the under eye bag is much more prominent and is not amenable to being treated, or it's not appropriate to treat this area because you might create too much volume, then the option for that is a procedure called a lower eyelid blepharoplasty, and typically a transconjunctival blepharoplasty. So I think you want to take, or I would recommend that you take little steps. You know, you are still very young, and I tend to be, and this is a personal style, I tend to be very conservative. I always tell younger people that once you get into your 40s and over, there will be plenty of opportunity to do things because facial aging changes will manifest more significantly. But prior to that, little things can go a long way, whether it's cheek augmentation, lip augmentation. The little things can actually make a nice difference for people who are genetically do not have the volume in those areas that they desire. So learn about these options. Find a doctor that you are going to be comfortable with. You really need to feel comfortable with the doctor's style, the aesthetic, and learn about what you'd like to be, what you'd like to try. You know, very often when we discuss these issues with patients, we kind of come up with a priority list. And then we figure out what's the highest priority and try to go with what's going to be have the most significant impact, cost the least amount, and will be likely to be satisfactory. So learn about these different options. You may need to visit a few different doctors and then find one you're comfortable with and move forward and take your first step. So I hope that was helpful. I wish you the best of luck. Thank you for your question.